Hi, I'm Dr. Bill Fulton, and welcome to Hot Looks TV. I'm the medical director at SKINovative of Gilbert and Center for Venous Disease. And today's episode on Hot Looks TV is going to talk about venous insufficiency or venous disease of the lower extremities. I'm going to be doing a series of videos on venous insufficiency. At SKINovative of Gilbert and Center for Venous Disease, we treat venous disease of the lower extremities, and so I want to get you to be an expert on that. Venous disease is simply blood flowing the wrong direction. And to get a baseline for that, let's talk a little bit about the veins that involve the leg. There's three different venous systems. There's the deep system, and when I talk about deep, it's the system that's the deepest from the skin. Those are usually the larger veins. And then there's the superficial veins. And then there are a vein system that connects the deep and the superficial. That's called the perforating vein. So again, just to review, three venous systems in the legs: the deep system, the superficial system, and the perforator system. In general, arterial blood flows away from the heart and venous blood flows towards the heart. And that's the way it works in the legs. But sometimes that process gets mixed up and stops functioning correctly. Often the reason for venous insufficiency is because the valves in the legs stop working correctly. Just as an overview, in general what happens when the heart beats, the valve in the legs, I'll make my arms and my hands as a valve and a vein. What happens is when the heart beats, the valve opens, the blood goes towards the heart, and then when the heart relaxes, the valve closes to prevent the blood from flowing backwards. But there's three general reasons why those valves may stop functioning correctly. The first one is, for various reasons, those veins will dilate. And just as my hands move apart, that's what happens to those valve leaflets. And again, even if the valve is working correctly, you can see that area in between my fingers where blood would flow back towards the heart, or excuse me, back towards the feet. The second thing that can happen is for some reason the valve may get damaged. And just as I demonstrate here, maybe one of the leaflets is working correctly and the other one's not. And again, instead of closing as it should, again, the blood's going to flow back towards the legs, which we don't want. The last thing is sometimes some individuals are born with valves that just don't function correctly. And because of that, they get the symptoms of venous insufficiency. I'm going to be going into a lot more detail about venous insufficiency in future videos, but I wanted to give you some basics so that we can talk about it on the same footing. Again, if you have any questions, I encourage you to put that question in the Dr. Bill box. If you have any friends or family that you think would be interested, please send this link to them so they can get all the videos for free. And as always, the information is priceless and the cost is free. So I look forward to seeing you in future episodes. Have a great day.